Welcome everybody, we're on the home straight. We have got a short period of time still to go whereby we've got time for questions, and an illustrious panel for you today. And I've just had an email come in, thank you Lisa, saying what a handsome panel you are. Lisa, thank you. That's a way that I have never started a question and answer session before, so thank you Lisa, it means a lot. We look beautiful, wonderful. So colleagues, you have got now 20 minutes of this group's time. We have got a question box. Yeah, thank you Claire, will you please be polite in the question box? What we have got is we've got people on the panel here. We'll do some introductions in a moment so you know who you have got. Please put your questions into the question box. I have a number of questions that people have sent in over the last 4 days that we can utilise whilst we're letting you warm up. What will happen is it will get to a crescendoed frenzy in about 19 minutes time, I imagine. So please know that we will answer the questions and make sure that that is answered in good time. So I will be looking at the question box, that's my job. And I am, as you know, Beverley Harden.
Hi Bev, I think you might have frozen. I think she's just gone offline. She's going to try and rejoin, I think.
Should we carry on introducing ourselves, Sean?
If you wouldn't mind, Richard, that would be great.
So I will introduce myself. I'm Richard Collier. I'm the lead for the Centre for Advancing Practice in Health Education England. I will ask Jan to introduce herself.
Hi everybody, I'm Jan Zietara. I'm the National Programme Lead for Advancing Practice and also Allied Health Professionals. Elaine?
And I'm on mute. Sorry, I've got a really bad habit of that. So my name's Elaine Jenkins. I'm the Development Lead for the Portfolio Route work. Over to Suzie.
Hello everybody, I'm Suzie Normanton. I'm the Development Lead for the Programme Accreditation work at the Centre.
So in the absence of Bev, I'm going to, I think there were a couple of questions, weren't there, Elaine, that came your way that might be worth asking at this point while we're waiting for Bev?
Sure. I mean, one of the ones was just really, where are we with the feasibility study? So just a quick update. So for the portfolio route, we've put in place a feasibility study. We've got a beautiful process written down on paper, and it's an opportunity to actually test it out on practice with the group. We've got 2 cohorts at the moment participating in the feasibility study. The first cohort are those which we are calling the independent group. This is a group who will go through, have come from a range of backgrounds with a range of educational qualifications. And so we'll be going through the what we're calling the independent portfolio route and do that. We have 31 colleagues who have joined us in the feasibility study and they're up and running now, uploading evidence and looking at their critical narrative. So that's really exciting. We've done briefing sessions with them and we've got them engaged in the process. Our second cohort is to really extend it and look at the other part of the portfolio route, which is this is the group which we're calling the HEI or the Education Provider Supported Route. So this is a group of individuals who have gone through what I affectionately known as the Wessex projects and work with the University of Southampton and Bournemouth University. And they've gone through a particular module that looks about learning needs analysis in relation to the ACP framework. And so we've got a group there. They have a portfolio that has been assessed by both universities. So they're in a different place, slightly different place from our independent cohort. And so this is cohort 2, and we have 38 of those at the moment. And we're just going through the briefing sessions and they're about to go onto the portal and start the process. So it's a really exciting time, Richard, and it's just really great to have people involved in it now.
Thank you, Elaine. So we've got a few questions here that I'm going to hand over to Bev when she comes back online. But what I'm just going to ask Suzie to do while we're waiting for Bev is just to give us a quick update on where we are with programme accreditation, because we've got we're starting the process of accrediting programmes, and it'd be quite useful, I think, for the world to hear what's going on in that respect. Suzie.
Thank you, Richard. Yes, we've made really great progress over the last 8 weeks. So we have programmes that came from HEIs from July through to October that we're in receipt of, and they're at various stages of our review process. Some heading towards the end of that process, which is incredibly exciting for the team and really good progress. We've got a huge demand for current programmes running up until March 2021 at the moment, and all of those slots actually are full, and we're really enjoying linking and liaising with our HEIs just to confirm their submission intentions, clarify any areas that we can help them with, and make sure that their programmes meet our current programme submission criteria. We've also developed a legacy programme option that we're talking to HEI colleagues about. So great progress. And of course, the next thing is, what will we be doing in 2021? Well, there'll be a demand survey that will open in December for HEIs that haven't yet managed to book an accreditation slot. Richard, I hand back to you.
Suzie, there's a follow-up question about the time frame that the HEIs might expect to hear on outcomes following a programme submission. So perhaps you'd just like to address that question.
Yes, thank you, Richard. We're working to a time frame of approximately 16 weeks. There's various stages to go through, including the receipt of initial documentation, working with the local quality and the local leads to understand what their knowledge is of these programmes, and then out to independent review, and then some stages where we can seek additional clarifying points of information from HEIs. We then go through an internal and an external process of validation and critique and discussion before ultimately reporting to the Education Assurance Group, which Richard chairs. So it is round about 16 weeks. We do hope to communicate at round about 4 to 6 weeks, when we will advise you that your programme has passed successfully through what we're calling a threshold review, and at that point we advise you that you can bed your programme accreditation pending. I hope that answers the question.
Thank you. I'm going to ask Jan a question, and then I'm going to hand back to Bev, if I may, to carry on the questions. So there's been some questions, Jan, about the commissioning arrangements for advanced practice programmes going forward. Did you want to just take that and see what you can do with that question?
Yes, certainly, Richard. Thank you for that. So at the moment, each region approaches commissioning of advancing practice in their own unique way, and that's sort of developed and grown organically. What that means is that we don't really have a consistent approach to commissioning advancing practice. So that's something that I'm working with representatives from HE's transformation team, from the commissioning team, and also from the advanced practice community, to really review what good practice is already out there and how we can move that forward and develop a new commissioning framework specifically for advancing practice. So that will be looking at levels of funding, it will be looking at processes for commissioning, and the sort of systems and processes that support that. Now, obviously, this work will be in partnership with the new faculties, and the sort of faculties will be there really translating and helping and supporting us with those commissioning conversations, and indeed having those conversations at the real local system level, so STPs and ICSs.
Thank you, Jan. Beverley, can I hand back to you and see if you, I don't know, hopefully you can see the questions as well.
I certainly can. It just about sums up our IT experience of the last 2 days together, doesn't it, really, that my IT should go down at this point. But having a husband working at home today who's sorted it out for me. So this was for you, Richard, this one. So obviously with the advanced practice work, we have got the pillars of practice and we've got various different pieces of how we are developing the workforce. Emma asks, how will the HEE reviewer role and the ACP supervision lead role link in with the wider ACP workforce development? How will that be useful to us in really developing people, is what I've taken from that question, Richard.
Let me see if I can find it on here. HEE reviewer role, ACP supervision.
Have you got it?
Yeah, so so the HEE reviewer role, so I'm assuming you're referring to the reviewers that we're recruiting at the moment to review the submissions from the HEIs. Is that what I'm wondering whether that's what the question is?
Shall we ask Emma to come back with some clarification in the box, Richard? Would that be helpful?
I'm going to be a bit thick about that.
No problem.
I don't want to waffle on.
So Joanne's asked, would it be beneficial for future conferences to have input from other areas who have developed work already? In the context of Joanne's question, it was around the specialist competencies for sexual health. And the answer is absolutely, Joanne. I think the issue for us is that we are starting somewhere. And one of the first pieces of work to be done was some of the sexual health credentials that were put in place by Matthew and wider colleagues. And so for us, there's a piece which is, we are currently doing a stocktake of all the work that's ongoing at the moment, and then understanding actually what fits within the scope of the centre, what doesn't, because there's room for all of us. There's plenty of work to be done here. There is no need for overarching control. So there's a real challenge for us here about making sure that we are respectful of everything that's out there already. We are not duplicating at any point. So part of the hoovering up of all the information that we have, Joanne, is going on currently. So you'll be part of those conversations. Perhaps you could drop us an email to the advanced practice at hee.nhs.uk inbox so we can connect with you directly to make sure that we've got all of that that work captured as part of what we're doing. So absolutely. And I think the challenge then is about how do we then look to work through others' conferences rather than for everything to be laundered through the central piece here. So again, exploration work for us all to do. So next question. So there's a piece here about how we might be able to link people who are engaged in patient representative work. Richard, I know you're very involved with our patient groups within, or our service user human being groups within HEE. So Andrew says at Guy's and St Thomas's, himself and a colleague have launched some work around patient engagement and would like to look at filling in some of the gaps in literature, and what networks are there within HEE where we might be able to link people who have got interest in patient engagement in this work, Richard?
So thank you for that. We've got lots of patient engagement in all our work. What we've tried to do is ensure that we have them in every level, but sometimes you just need to be, it needs to be pointed out where they could be more helpful. We would like to bring patient engagement in at perhaps chairing some of our various committees. I've done lots of engagement with the Patient Advisory Forum to try and get them to help us better understand what advanced practice is about. But I think what would be particularly useful is if the patients could engage with the new regional faculties that are emerging, because I think that would be a really good place. There are 7 of these regional faculties that are being set up, and it would mean that we could get a regional view of the patient's views, which would be, I think, really very helpful rather than simply getting a centralized view. One of the things that I hope you'll appreciate is how challenging it is when one person represents an entire group of people, or even a small group of people represents a vast number of people. And we are all patients at some point in the system. So yeah, that would be my suggestion, is contact your local regions in the first instance and see to what extent they are engaging with the patient forum.
Thank you very much indeed. So Emma, who asked a question about the developmental opportunities with the centre accreditation roles and the supervision role, has said that you'll speak to regional leads, Emma. Well, I think the issue for me is that there's a real opportunity here for me around advanced practitioners who are looking for CPD opportunities, getting involved in other pieces of work. There's going to be a lot of supervision work that needs to be done, and regions will work really collegiately together with their regional supervision leads. So there's a huge developmental opportunity there for existing ACPs, consultant practitioners and others. And again, as part of the panels, people who are expert in understanding the roles of the advanced practice roles, but also the education training of those. There's a huge opportunity here, people to engage in this both as CPD, but also as part of people developing and then potentially moving into some of those regional roles in the future. So much of what we're trying to do is build capacity and capability in our workforce, so we're creating our next layer of leaders, because this multi-professional space is a really interesting place to work in, where we can respect the individuality of all of us, but still bring together the magic of the collective. And that's a really challenging skill set to learn. So hopefully the work that we do will give people a lot of opportunity to engage and a lot of opportunity to develop. So S has also come back to say that we have got patient reps or service user reps or human being reps in all of the rehab capability work, absolutely, and through all of the development of credentials, having the voice of people who receive services is absolutely key to those pieces of work. So that's fantastic. So here's again, Richard again, I'm afraid you're popular today. Do you see that advanced practitioners will follow the same credential process at the moment as potentially diagnostic radiographers do currently? And again, I think a radiography call to be heard too, and absolutely, radiographers, please know that we are absolutely active in imaging currently. And actually, for us, I think there's a bit about, there is so much work ongoing now. It's how do we ever shine a light on all of the magic? And as Richard said earlier, about trying to make sure we don't pin, or Joy said earlier, not pin things down too much, but enough that we have that transferability and that recognisability. So Richard, a commentary on similar processes to what the radiographers have in place already, please.
So I think it's a matter of language. What we have chosen to use in terms of the language for what's referred to in some areas of practice about credentialing, we're using the term recognition. So HE will undertake a recognition process, which is the same as credentialing. So that is simply the word we chose to use. So I think if that's the question here, so the process that the diagnostic radiographers go through is an examination of their quality, their qualifications, their ability to undertake a particular role, undertake what their learning and has been, and it's exactly what we're doing through our portfolio process that Elaine referred to earlier. And we're working very closely with the Society and College of Radiography to see to what extent we can mirror or match their processes. Just want everybody to be aware there are three groups that undertake credentialing of people. That's the Royal College of Nursing, the pharmacists and radiographers. The radiographers, I think, call it accrediting, but forgive me if that's wrong. And what we wanted to do right from the start was to work with these groups, because we recognised that HE stepping into this space, we were possibly stepping on into their area of practice as well. So we've been working with these groups for some time now. It feels like several years to just try better understand what those processes are, and particularly Elaine has been undertaking some work with myself to see how we can match these processes, because what we would like to see is whether we can recognise what those professional bodies undertake and that they can recognise what we undertake, either in the form of a reciprocity agreement or in the form of an agreement that we will recognise each other's qualifications and approaches. So that's what we're doing with those groups. But of course, there are other professional bodies and other groups in our world. I think something like 26 different professions are identified. Bev has gone through them this morning to identify, that it's a large family, large broad church of individuals, and we'd like to be aligned with as far as possible all of these processes, so that we're completely inclusive.
Thank you, Richard. Elaine, and if I answer a question that was asked whilst I was out, please tell me, Elaine. I completed my master's a while ago. Should I wait until I find out if my university is being accredited, or should I go through the portfolio route anyway, Elaine?
Yeah, that's a really interesting question, in terms of, we don't want to give you more work than you need to do. So if you're in a situation where you've got a master's like that, the best thing to do is email us through, I think, the IPR@he.nhs.uk email address, and raise that. We'll liaise. I work very closely with Suzie, and we'll look at the scheduling of timings of when your university is going through. We'll also need a little bit of detail about when you completed that programme, whether that's going to be within the accreditation period. So I think at this stage, it's contact us, give us the information, then we can see what is best to do and discuss with you in terms of timings, whether it's better to wait or whether you feel that going through the portfolio will be really helpful. And part of it is also thinking about where you are in terms of your CPD and whether actually you've got that evidence to hand. So it's a discussion point at this stage.
Beautiful, thank you, Elaine. Jan, a quick one here. Centre web pages. Do we plan to have some web pages dedicated to the centre, so we start to create some form to it? You're on mute, Jan.
We go. Absolutely, Beverley. In fact, we're currently commissioning 2 quite significant pieces of publicity work to support the messaging of the centre, to make sure that advancing practice is really understood, both from an individual perspective and from an organisational perspective. Working alongside Jane from our comms team, the output from this will be resources and indeed a narrative that we will then share on our website, so that our work is very clear, and obviously we would welcome any feedback on that as and when that takes place. Thank you.
Thank you, Jan, that's great. And part of what we wanted to do is check back in with everybody here. We've been through a very tricky year, and I think for us now, we bring you today the centre, we bring you the credentials, we move forwards together. There's a bit about checking in, moving off again together. Okay, it says a very quick one here. Will ACP credentialing, Richard, make it easier to transfer between hospitals and organisations?
Absolutely.
Are you fine?
Absolutely.
Yeah, brilliant.
Absolutely. I think that's the intention, is that what we want to try and do is to get consistency across the system, so that we have this notion that if you undertake a credential in one university or other education provider, because I see the credentials being delivered not just by universities but by a whole broad range of education providers, that there would be consistency in terms of what's taught, what's learnt, what's understood by the credential, the knowledge that's delivered, and the assessment method. So absolutely, transferability is one of the key things that's key to this. But of course, what we have to do is to ensure that the credentials themselves are properly constructed, so that they meet service needs. So you have to start with it's an iterative circle about meeting needs, because we all know that we've all undertaken training, and when we get out to clinical practice, find that isn't actually what we do in clinical practice. So maintaining the currency of the credentials is really key. But absolutely, yes.
Right then. So next one then is, Richard, where does the credentialing, the credential process and the directory sit alongside the HCPC or the NMC or the General Pharmaceutical Council or any of our regulatory bodies?
So I think we need to say right from the start that we've had conversations with the regulators, all of the ones you mentioned there, Beverley, right from the start, because what we really wanted to understand is how we were being perceived in this space. What was our relationship with the regulators? And we've opened up as many avenues of communication with those regulatory bodies as we've gone along. So we've discussed with them all our plans, all our thinking around how we would work with them. So it's important to underline work with them, not in opposition to them. So you will know that the regulatory bodies, the NMC, the HCPC, are currently looking at whether advanced practice needs to be regulated or not. So that's a conversation we are engaging in. We're very keen to have that conversation. We believe that we can work alongside them. We believe that we bring complementary skills to the table. It doesn't replace regulation by any stretch of the imagination. The initial conversations with the regulators went along the lines of, if you're working in any role and you are trained appropriately in that role, it is within your scope of practice. Therefore it is within the governance of the regulator, and you will always be called to account to the regulator if something goes amiss. So that I don't think has changed, but it's just what we want to do as we move forward, as this process develops, is to work very closely with the regulators. So we either can continue to work in this symbiotic relationship, we can hand over a relationship role to the regulator, or they allow us to continue to sit in the space and perhaps have a more pivotal role. I think that we're very open to whatever works in the best interest of patient safety.
Thank you very much indeed. Elaine, one for you here. How does somebody become one of your reviewers, Elaine?
Okay, so we've just done our first sort of tranche of recruitment, and we're going through the interview process. So at the moment, we have our first cohort of reviewers. If you're interested in becoming a reviewer in the future, again, if you email through the if you email through the reviewer@hee.nhs.uk email address, we'll log your name, and then the next time we're going into another tranche and recruiting another tranche of reviewers, we can make sure that we were in touch to let you know that the recruitment process has started. Closed at the moment, but give us your name and we can get in touch if there's future recruitment.
Can you give us that email address again, please, Elaine?
Yes, it's reviewer@hee.nhs.uk.
Thank you. Brilliant. Lovely. Suzie, one for you. When will people be able to recognise that a course is accredited by the Centre for Advancing Practice? I might be looking for a master's degree or a set of modules that meets my need. When will I know that it meets the kite mark, Suzie?
Yes, so currently this is really with our HEI colleagues who are applying for accreditation of their courses, and as I mentioned earlier, we're partway through that process with some HEIs, and we have an awful lot booked to move forward with accreditation of their courses. So I guess at that point for me it's really you need to check with the HEI that you're considering doing your course or your modules with, what their plans are for accreditation, where they are within the process, how current their programme is, and yes, what they're looking to do and within what time frame. I think it's probably important to mention, Beverley, that courses submitted for accreditation, the accreditation is backdated until the university validation date within a 5-year period. So actually we will be capturing an awful lot of people through that process. I hope that helps.
That's brilliant, thank you. Here's one from Carl.
Elaine's waving her hand there, Beverley.
Oh, sorry, thank you, Elaine.
Also to add to what Susie's been saying is that we're in the process and very close to finishing the development of a directory that will list the programmes when they are accredited. So you'll be able to, it's a public facing directory, you'll be able to go on, so if you're interested, be able to search it and see those ones that are accredited. But we're just on the final stages of putting that together.
Super duper, thank you. So Carl's question was, are we planning to create a professional body for advanced practitioners? And the answer there is no, Carl, we're not planning to create a professional body for advanced practitioners. We have a wealth of fabulous, brilliant professional bodies. What we are creating is a professional community that enables us to have the voice for advanced practitioners. It enables us to support the education and development of advanced practitioners. It enables us to support CPD, so we can do many of the things that are required, but you all have fantastic professional bodies. And I want to bring us back to Gwyn's egg yolks and egg whites. And actually, as a physiotherapist, I'm a proud physiotherapist. I will always be a member of my professional body because that's my identity as a physiotherapist. I can also be part of the Centre for Advancing Practice because that's my identity as an advanced practitioner. And as I can be Beverley, the wife, the mother, the daughter, the friend, I can also be Beverley, the advanced practitioner, the physiotherapist and the respiratory specialist. And so I think there's a bit for us about working in that more matrix way, Carl, to be frank. So we will not be creating a professional body for advanced practice. I think we would lose more than we gain, but it does not mean that we won't have a very strong voice and a very strong presence and a very strong support, but we'll do that. Remember the octopus we had years before? It was the octopus, which is the tentacles we wrap around everybody as an enabling and supportive function. We're not here to be something that we're not. We're simply here to fill in the space that enables us to craft multi-professional genius, not as scrambled eggs, but as fried eggs in that frying pan. So really important piece of positioning for us in where we are. Question for Jan from Katrina. Katrina, you can say the word that you know the work behind this one, Katrina. Are we going to refresh the ACP toolkit, Jan?
Absolutely, Katrina, and obviously we will publicise it far and wide.
Yeah, and we'll be coming back in your direction, I fear, Katrina, so be nervous. Okay. So Andrew, to start off, will the professional regulators be regulating advanced practice? Well, I think we've just answered that one to say that they are reviewing and thinking and understanding where we are currently.
Can I just come in there, Bev, because I was just responding to Ross there. I mean, we're not a regulatory body. I think it's important to emphasise that. So our remit here is quality assuring education and training. The regulators will have a regulatory role, and we will have a role over quality assuring education and training. And I think the two are, as I said before, they are symbiotic. They can sit very comfortably side by side, and I think that would be my response to that. But you know, I'm just saying this to Ross, and he can come back to me again about it.
I'm afraid time's up, people. Thank you for your questions. And there's one about the Leadership Academy, and we're working absolutely closely with the Leadership Academy to understand how we can support really easy translation of the fantastic work that they do into our world, and they've got 2 fellows working with them who are working very closely with Richard. I just want to stop at this point, thank the panel enormously for your wisdom and your insights. Fantastic. You are beautiful, and it's been a pleasure sharing the screen with you all. And to say thank you to everybody who's joined. It's been a fantastic 2 days together. I'm so sorry about all of the IT challenges that you've all experienced. We've tried to sort them where we can, beyond my control. You've seen my IT skills today. I can't even get my internet to work. So, you know, I can only send heartfelt apologies. But to thank you all enormously for everything that you have done, everything that you are doing, and all of you be nervous because there's a lot more work to do, and so everything that you will be doing as well. We are so grateful for the collegiate, collaborative work that is going on, but also the kindness and the constructive support that people give in helping us get this right. This is so hard to do, so hard to do. Together we can do it, on our own we can't. So please stay with us in the spirit of collaboration, kindness, and helping us get it into the right place so that it's right for my mum, for your mum, so that we can absolutely deliver for people the right care. So thank you everybody very much indeed. Have a great rest of your day. Please keep the conversations going on Twitter, and just know that we are incredibly grateful, and see you next year.